And people are just kind of tired. They're like fatigued with all this talk. But the reality is that the things that have always been a problem in the United States, like RSV, influenza, adenovirus, all these types of things, are now getting coming in higher numbers now because we were masked for so long and they just kind of went away. Because you have to think about it, we all have antibodies to those things I just mentioned. But when you have masks, you don't spread this, and so the numbers kind of went almost to zero. But now that they're back, we haven't seen this in the last couple of years. Your body hasn't seen it, which means that the antibodies have to be made. And we know when you're making antibodies, that means you're going to probably get sick. So I just don't want people to just act like this is over, because if something happens to you, no matter if it's rare or not, it's 100% in your household, and it could be devastating for you and your family.
Right? So think about that tonight before you make your plans for tomorrow. Let's talk about a few of these things. You brought up RSV. First of all, what is it and why are we seeing more of it right now, and who's most at risk?
Okay, so RSV stands for respiratory syncytial virus. This virus has been around for a very long time. We deal with it all the time. As a matter of fact, there's an immune globulin that we use for babies that are of low birth weight, that have cardiac problems. To protect them, we have to give it every month. It's very expensive, so that's a whole nother conversation as to why everybody doesn't get this. But we're working on an RSV vaccine right now. But the reality of this in this situation is that the babies and elderly people that get infected with RSV can have a huge problem. I mean, babies die every year from RSV, and it just gets into the lungs and forms a functional syncytium. That's where the word syncytial virus comes from. So it works with the lungs so that it kind of destroys the lung tissue, which can be obviously regenerated, but it destroys lung tissue and makes it difficult to breathe. So it's a respiratory distress disease.
And people die from the flu, Dr. Hebert, but you don't hear people talk about flu deaths all that much. I hear a lot of people say, I'll get the flu, I'll get over it, but the numbers are striking and they're very concerning. So I think it's important to convey that.
Oh, absolutely. I mean, we talk about the pandemic in the early 1900s that killed millions of people. That was influenza. And what people they get so used to saying, oh, I got the flu and I get over it. They don't realize that you being sick for a couple of days is not the flu. Influenza, which is where the word quote unquote flu comes from, influenza is a disease that has been around for thousands of years, and it kills, in terms of the United States, it kills either from 15,000 to 75,000 people every year. Every year. So, and you can't get the flu from a flu shot. And I say that till I'm blue in the face, but you can. And we need to protect ourselves, especially the people that are most vulnerable from disease. We need to protect them as much as we can. So you need to get your flu shot. It takes about 2 or 3 weeks for it to be active. So you need to get it now. But influenza is a deadly disease. It was before COVID. It's going to be after COVID. And I'm telling you, if you ever had influenza, I don't mean I got the flu for a couple of days. I mean, if you ever had influenza, you will never miss your flu shot, because I got it when I was a young intern in 1997, and I will never not get a flu shot.
Right. And it's even a risk for people who are healthy. So you talk about the immunocompromised for RSV, but the flu can impact and be deadly for even a healthy adult.
Every year, thousands of healthy, middle-aged, 20-year-olds, 30-year-olds, 40-year-olds, all can die from influenza, and it happens every year. And so we kind of act like it's not that big of a deal, but I'm telling you, it is a very serious disease. It can cause encephalitis, meningitis. Also, just the virus itself can just infect you and really cause devastating damage to your body, and you can die. So, I mean, like I said, nobody wants to be doom and gloom, the day before, we celebrate our families and coming together. But the reality is that if you want your family to be around next year, you better do what you need to do this year. I think we got one more year to just get things back to normal. And if you can just stick it out for just one more Thanksgiving, Christmas, New Year's season, I think we'll be fine next year. But I'm telling you, don't risk it now. It's not worth it.
Yep. Healthy habits. Hey, real quickly before I let you go, you mentioned fatigue when it comes to vaccines. We've seen a lot of people put off the COVID booster because they've either had COVID or they've had a couple of the shots. What's your advice on that?
Yeah, don't put off your boosters. I'm telling you, I know you're tired of this, but you just a little bit longer. I do not want you to limp. I don't want our country to limp across this finish line. I want us to lean in, lean at the tape, and finish strong so we can be done with this for good. And that's what I'm hoping for. So please get your boosters.
Dr. Hebert, happy Thanksgiving to you. Thank you for that message. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.